Assalamualaikum and hi, Teacher Aisha here. So today I will be presenting on attention deficit hyperactivity disorder or ADHD. So first we will be going on through what is attention deficit hyperactivity disorder or ADHD. ADHD characterized by significant difficulty with selective or sustained attention to tasks. ADHD may be accompanied by difficulties with overactivity or impulsivity. ADHD is a developmental disorder associated with an ongoing pattern of inattention, which is having difficulty paying attention, hyperactivity, having too much energy or moving and talking too much, or impulsivity, which is acting without thinking or having difficulty with self-control. ADHD usually begins in childhood and can continue into the teen years and adulthood. People with ADHD experience an ongoing pattern of inattention, hyperactivity, and impulsivity types of symptoms. Some people with ADHD mainly have symptoms of inattention. Others mostly have symptoms of hyperactivity, impulsivity, or some people may have both types of symptoms. Symptoms of ADHD can interfere with daily activities and relationships in our life. As what that have been explained earlier, ADHD is a developmental disorder associated with an ongoing pattern of inattention, hyperactivity, or impulsivity. So, the signs of inattention may include not paying close attention to details or making seemingly careless mistakes in schoolwork or during other activities, difficulty sustaining attention in play and tasks, including conversations, tests, or lengthy assignments, trouble listening closely when spoken to directly, finding it hard to follow through on instructions or to finish schoolwork or chores or starting tasks but losing focus and getting easily sidetracked. Difficulty organizing tasks and activities, such as doing tasks in sequence, keeping materials and belongings in order, managing time and meeting deadlines. Avoiding tasks that require sustained mental effort, such as homework. Losing things necessary for tasks or activities, such as school supplies, books, eyeglasses, and cell phones, being easily distracted by unrelated talks or stimuli, and being forgetful during daily activities, such as chores, errands, and keeping appointments. The other ongoing patterns of ADHD was hyperactivity and impulsivity. The signs of hyperactivity and impulsivity may include fidgeting and screaming while seated, getting up and moving around when expected to stay seated, such as in a classroom, running, dashing around, or climbing at inappropriate times or in teams, often feeling restless, being unable to play or engage in hobbies quietly, being constantly in motion or on the go, or acting as if driven by a motor, talking excessively, answering questions before they are fully asked or finishing other people's sentence, having difficulty waiting one turns, such as when standing in line, interrupting or intruding on others, for example in conversations, games, or activities. So, how ADHD diagnosis was done? The ADHD diagnosis, including structured observation in a variety of settings and across time. During an evaluation, the healthcare provider or mental health professional may examine the child's mental health and medical history, have a talk with family members, teachers, and other adults who know the child well and see them in different settings to learn about the child's behavior and experience at home and school. They too may use standardized behavior rating scales or ADHD symptom checklists to determine whether a child or teen meets the criteria for a diagnosis of ADHD. And lastly, administer psychological tests that look at working memory, executive functioning, abilities such as planning and decision making, visual and spatial skills or reasoning skills, such as tests can help detect psychological or cognitive strengths and challenge as well as identify or rule out possible learning disabilities. There are a few interventions that will be proposed for ADHD, which is medication, parent education and support, school-based programs, and psychotherapy and psychosocial interventions. Okay, firstly, we will be going on through medication. Medication, which is stimulants, are the most common type of medication used to treat ADHD. Non-stimulant medications are also available. Like all medications, they can have side effects and require an individual's healthcare provider to monitor how they may be reacting to the medication. The other intervention was parent education and support. Through this intervention, the parents will be educated on ADHD, which is about the disorder and how it affects a family. Through this intervention, which is parent education and support, will help parents and children develop new skills, attitudes, and ways of relating to each other. Examples include parenting skills training, stress management techniques for parents, and support groups that help parents and families connect with others who have similar concerns. So the other intervention was school-based programs, which is children and adolescents with ADHD typically benefit from this intervention, which is from classroom-based behavioral interventions or academic accommodations. Interventions may include behavior management plans or teaching organizational or study skills. Accommodations may include preferential seating in the classroom, reduced classwork load, or extended time on tests and exams. The last intervention will be proposed by mental health provider or professional providers, which is psychotherapy and psychosocial interventions. Behavioral therapy aims to help a person change their behavior. It might involve practical assistance, such as help organizing tasks or completing schoolwork, learning social skills, or monitoring one's own behavior and receiving praise or rewards for acting in a desired way. Cognitive behavioral therapy helps a person to become more aware of attention and concentration challenge and to work on skills to improve skills. Okay, other than behavioral therapy and cognitive behavioral therapy, there are family and marital therapy, which is can help family members learn disruptive behaviors, encourage behavior, improve interactions with children. This type of therapy for children and teens really require parents to play an active role. Psychotherapy that includes only individual treatment session with the child, which is without parent involvement, is not effective for managing ADHD symptoms and behavior. This type of treatment is more likely to be effective for treating symptoms of anxiety or depression that may occur along with ADHD. So that's all from me on topic ADHD or attention deficit hyperactivity disorder. Thank you for listening.